because we are actually lucky enough to have a special guest with us here live on the stream to talk about another initiative that we've kind of been discussing all throughout this month and beyond. We're going to be talking about colorectal cancer, the risk factors, the ways to potentially combat this horrible disease, why it's so important to pay attention to. And to do that, we welcome Dr. Jamila Wynter onto our program from Riverside Health. Dr. Wynter, thank you so much for taking the time. I apologize for the sort of long intro to this particular episode. I know you've been waiting to join us. We appreciate your patience. How's everything today with you?
Thank you so much for inviting me on.
Wonderful, wonderful. I mean, we appreciate you being here, and we're going to jump into some questions to talk about colorectal cancer. We're bringing specific awareness to that form of this terrible disease. We've been doing so all throughout the month. Let's just start with the basics. What is colorectal cancer? How does it develop?
That's a great question. So, colon cancer, oh, can you hear me?
Yes, we can.
Okay, great. So, colon cancer basically is abnormal cell growth in the lining of the large intestines, which comprises the colon and rectum, and that basically makes up the lower gastrointestinal digestive tract.
And we know that we've done some reporting here on 13 News Now that this is a disease that has been getting more attention recently, specifically due to its sort of growing impacts on young people. Could you tell us a little bit about how maybe the demographics of who this has been
Right?
impacting has changed a little bit?
Absolutely. So, colorectal cancer has become popularized in mainstream media mostly because of the untimely death of James Vanderbeek most recently and Chadwick Boseman several years ago. And the reason why this is now becoming a very hot topic is because colorectal cancer is the leading cause of cancer death among young adults, ages 50 years and younger. And so this disease is no longer a disease of the old, but now we start seeing it more and more in younger populations.
And I was actually speaking to someone here at the station earlier today, and they were asking what we're going to be doing on Live Impact News this afternoon, what we had planned. And I mentioned that we had you coming on for an interview. And that person just instinctively said, "Oh, yeah, you're supposed to get checked after you're 45, right?" I'm wondering if that is a piece of advice that has changed at all, if that is still the standard advice of when people should start seriously checking for this issue.
So for colon cancer screening, so screening is when you are asymptomatic, you have no symptoms of colon cancer. The recommendation is to get screened at age 45. And so those are for people who are not having symptoms and for people who are average risk, meaning no family history of colon cancer and no personal history of colon polyps. So the age now is 45 years old. However, if you do have a family history of colon cancer, that may be younger.
Okay, and I guess shout out to our coworker who kind of had that information on lockdown. I'm going to let him know after this show, hey, you nailed it. Good for you. We talk about how that family history is something that you need to be very careful of, and that if you do have a family history, you need to be more diligent in getting checked. But you also talk about early warning symptoms, early onset symptoms. What are some of those warning signs that people might overlook?
And so I want to make a very clear distinction. Colon cancer can be a silent killer. There are often times where patients don't have any symptoms, and that's why it's crucial to get screened, especially at the recommended age of 45 years old. However, if you're having what we call red flag symptoms, which include blood in the stool, abdominal pain, unintentional weight loss, changes in bowel habits to include constipation and or diarrhea, or anemia on labs that are otherwise unexplained, then it's time to talk to your primary care provider to see if you are someone that needs to get colon cancer screening.
Okay, so that's the list right there. But just because there's an absence of those symptoms doesn't mean that this isn't something you should be regularly getting checked for once you kind of get to that 45-year age mark. I'm wondering, you talk about how this has become the number one killer for young adults. I'm wondering, is there a difference in the symptoms you might see as a younger person versus once you get a little bit older?
So actually, the symptoms are quite similar in younger folks and in older folks. You still see those symptoms of, blood in the stool, belly pain, weight loss. However, it's really unfortunate because there's a little bit more delayed time of diagnosis in younger people because their symptoms are often misdiagnosed for benign diseases to include hemorrhoids or irritable bowel syndrome. And so, unfortunately, when young folks are diagnosed, they tend to be diagnosed later on in terms of their stage.
And for someone who is hearing all this and saying, hey, I need to kind of step up and be a little bit more careful, where can someone go and get screened? How
Right.
can someone get tested for this?
Absolutely. So if you're someone out there that are having any of these symptoms that are, alarming to you, or even if you're at the age of 45 and you're ready to get your colon cancer screening, it's time to have these discussions with your primary care provider or general practitioner, and then they can refer you to a gastroenterologist, so someone like myself who basically deals with disorders in the digestive tract.
Okay, and going to see a doctor for something like this, it can be sensitive for people. People can be hesitant to go and get checked out and get screened due to what can be sort of the invasive nature of the screening. People who are hesitant to do so, are there alternative options? And maybe what can you tell them to put them more at ease with going and getting these screenings done?
Yeah, it's so funny. No one likes to talk about poop, but I think, talking about poop is what I do day in and day out, and it's a very part of essentially the physical exam and self check and self diagnosis. So I encourage people to make sure that they themselves are investigating their stool habits in the home. But once you're ready for screening and for testing, there are many options that are out there. The most non-invasive test that most people are familiar with is the Cologuard stool-based testing, where you basically poop in a kit, and we test for advanced polyps or colon cancer in that way. However, the most appropriate test is the colonoscopy. We consider this the gold standard in the medical field because it's both diagnostic and therapeutic.
Okay, can we stay on that for a second? Diagnostic and therapeutic. Can you kind of diagnostic? I think is maybe self-explanatory. Therapeutic is not an adjective that I expect you to use for this particular screening. Why is it
Right.
considered therapeutic?
So a lot of people don't know this, but colon cancer actually derives or it develops from precancerous lesions in the lining of the colon called polyps. So polyps are benign, they're non-cancerous, right? And so polyps will form in the colon 10, 20, 30 years before they develop into full-blown cancer. And if we capture them at that stage early when they're precancerous, before they turn into cancer, and remove them outside of the colon, then that's basically curative. And so a colonoscopy is a direct visualization tool, basically a camera that we put in the rectum and colon, and we can look for these things called polyps. And at the time of the procedure, we can remove them and cut them out.
Okay, so both diagnostic and therapeutic. Awesome. And you mentioned how high profile figures, James Van Der Beek recently, Chadwick Boseman a few years ago, passing away due to this cancer. How has the landscape changed in terms of awareness, visibility, and maybe even in terms of these sort of tangible impacts on improving these numbers and saving lives? How has that changed following these high visibility deaths?
So actually, prior to 2021, the screening age was 50 when it came to colon cancer screening. But because we've seen these trends, especially now that they've become so popularized in media, we have actually decreased the screening age to age 45, which I'm very thankful for, and a lot of medical professionals are thankful for because of this slow, steady increase in the incidence of colorectal cancer. And I think it's important when we document these and talk about these, especially through the media, because it allows for people to be open and honest and start having these conversations around the dinner table with their loved ones and start talking about their family history and symptoms that they may be having. And I believe, having conversations early on really is impactful in early detection.
And knowing that conversations early on, going and getting screened early on, things that are relatively painless that anyone can do to prevent a disease that I'm sure that you have had to witness really, really be something that people struggle to go through. From your perspective, from what you do every day, how, from an emotional standpoint, knowing that there are easy ways to prevent this, but still seeing it impact people, what is that like for you and your team and those at Riverside Health? I mean, I wonder if that would help people jump into action, is to hear you kind of describe what that experience is like for you guys.
Yeah, it's a very daunting experience. A colorectal cancer, for about 90% of the cases, if they're detected early, they are treatable and beatable, right? And so when I see patients who have advanced stage or stage 3 or 4 colon cancer, it really is disheartening and it breaks my heart because I think if they had sought out screening 10, 20 years prior, this could have all been prevented. And so it really is my job, and I think the job of a lot of gastroenterologists and primary care doctors is to talk to their patients. Even it's never too early to have these conversations at age 20, 30, about any symptoms that they may be having or of their family history or getting them prepared for colon cancer screening later on in life.
Is this something that you make a point of talking to your friends and family about? Do you kind of consistently make sure to bring it up at the dinner table, as you say?
All the time, especially when it comes to nutritional health. You know, we didn't really talk about this, but we do think the reason why they're increasing risk of colon cancer in young folks is basically environmental, and we think it might be related to our diet. So I'm always harping on, especially my parents and grandparents, about what they're putting in their body. We think red meat and processed foods, ultra processed foods, smoking, alcohol consumption, obesity. We think all of these things are contributing to the high risk of colorectal cancer. And so these are conversations I'm having with my loved ones and my close friends, in addition to my patients.
And I'm assuming that's something that's kind of being studied rapidly here as we go. Are we learning more and more every day about what may be causing this?
Absolutely. I think there's a lot of data right now that is pointing to ultra processed foods and the nitrates that we're finding in deli meats and packaged products that might be linked to colorectal cancer. It's also very helpful that there's a lot of clinical trials going on right now in terms of immunotherapy and targeted therapies that can help shrink and eradicate colon cancer once it's formed.
Okay. All right. This is a lot of information. I can't tell you how much we appreciate you joining us. And hopefully, this helps and brings a little bit of awareness to something that people can take steps now to prevent having to deal with later. Is there anything else that you want to express before we let you go?
No, I just want to remind everyone it's March, it's Colon Cancer Awareness Month. So if you are 45, please go get screened. Or if you have a family history, talk to your care provider about timing of your colonoscopy.
All right, Dr. Wynter, it's been a pleasure. Thank you for everything you've done for us today. Thank you for everything that you guys do each and every day to help people protect their health. And hopefully, we'll see you down the road.
Thank you so much for having me.
All right, so that is a kind of a special interview here today. As you heard Dr. Wynter express, it is Colon Cancer Month. Anything we can do to try to bring awareness to something that, that is one of the main takeaways from that interview, right? Is that this is something that if you are prepared ahead of time, if you are paying attention ahead of time, that you can potentially prevent. And so, something to always be aware of and to help other people be aware of. Even if it is something that seems like an uncomfortable conversation, it's a conversation much better had than left quiet, especially considering the impacts that could come if you don't. So really, really happy to have Dr. Wynter join us right off the top of the show here. It's 1:21 p.m. now. We're going to take a brief commercial break. When we get back, we've got a couple things that we want to do. We've got some headlines of the day to go over. And of course, once again, we'll be talking Pause for Charity. So stay with us for this commercial.